Good morning. Today is Saturday, March the 2nd, 2024. This is our regular Saturday morning yoga therapy class. Okay, let's do a little sound check. Check, check, sound check. And let me check, 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 check. Okay, sound looks good. We are all set. And I see my friend Susan Turnit is joining. Thank you, Susan. And also I see Linda. Thank you. All of you must be feeling well. Now, first and foremost thing is that, as we said, we are having all the requests. And all the requests we are getting these days, teach me a pranayama or teach me meditation. I am, not in a position to do any asanas and physical. I said, in practice of yoga and yoga therapy, yes, if you look at asana, pranayama and meditation, and if you compare to a therapeutic pill, asana is your the ingredient, like aspirin, salicylic acid is the ingredient. Pranayama is the mechanism of action, and the whole therapeutic component of this is your meditation. Meditation is the medication. Now, yes, let's start. Today's practice is pranayama for chronic neck pain. We all have a neck pain, and I see a lot of people here who are from your healthcare provider. So let me give you the basic physiology. We call it a patho-physiology, physiopathology, before I show you the practices. Number one, the chronic neck pain comes from a condition called cervical spondylosis. S-P-O-N, spondylosis. And spondylosis basically means a wear and tear of your vertebra and the intervertebral disc, the space between the vertebral bodies, which are like a soft gelatinous material, and it is held with you can call it a band. So in a wear and tear, the band either ruptures or opens up, and portion will come out as we call it a herniated disc. That's a term you hear. Or by the wear and tear, you get a narrowing of the foramina. Foramina means opening through which the nerve roots are coming out from your spinal cord, causing the foraminal stenosis. And also, eventually, the whole space in the vertebral canal narrows, which is called a spinal stenosis. The pain comes from the irritation of the nerves, irritation of the nerve roots. When the nerve roots gets irritated, it causes the nerve root causes the tightness or spasm of the muscles. These tightness and spasm of the muscles causes pain because, the pain fibers are all either in the muscles or in your ligaments or in the tendons. They are not that prevalent in the cartilage or the bones or the periosteum. The covering may have some. So the primary cause of pain is your tightness. Same as a back pain. When you have a back pain, when you put your hand there, you'll feel like there is a two stones sitting there. And if you take a pain medication, it doesn't help. What helps is a muscle relaxant. So you will learn the relaxation response, including gentle asana practice. You need to prepare your physical body. Asana practice is not putting your body in the shape of a pretzel, in the shape of all the flexibility which we have because we practice daily. The asana practice is called a relaxation response. Activation of the parasympathetic tone to counteract this lifestyle of stress and bad habits, what we are doing. Anyway, all this thing is what happens from your high sympathetic overdrive. So we'll show how to do a very gentle relaxation before the pranayama practice and also for the chronic neck pain. Chronic neck pain also is from cervical spondylitis. Itis at the end, itis. When you get there at the end of itis, it's primarily an inflammation. So inflammation here in the cervical neck area also comes from your traumatic inflammation, trauma. A trauma which will cause the inflammation. Now remember, the pain in your chronic pain in your neck is the tightness. Because if the herniated disc or a spinal stenosis causes compression of the cervical vertebra or cervical spinal cord, you will have motor weakness. For example, if you get an injury to the neck, like you get a diving injury, other injuries, what happens? You get completely paraplegic. Like every muscles there is no function of the muscle. Same way, like, sometimes if there is a motor, you may have a weakness in your hands. If you have a motor weakness from a cervical lesion, we recommend surgery first. Because the decompression needs to be done first to save that area which is supplied by the motor nerve. It is a pain which we are recommending a yoga therapy, a relaxation response. Next concept is the pain is due to called anaerobic glycolysis. What is an anaerobic glycolysis? Is the simple chemistry. The end product of your metabolism is your glucose. The glucose combines with oxygen, forms a carbon dioxide, water, and ATP. ATP is the energy, adenosine triphosphate. And water comes out through your kidney, carbon dioxide comes out your lung. It is called an aerobic glycolysis. There is no pain-producing substances. In an anaerobic glycolysis, when the oxygen is not enough, glucose burns with a low oxygen, produces carbon dioxide, water, and lactic acid, pyruvic acid, and pain-producing substances. So one of the component of the pain-producing is your lactic acid, pyruvic acid, and pain-producing substances. A pranayama called a Bhastrika pranayama, bellows pranayama, it washes away all the residual carbon dioxide, and it also brings more oxygen in, and it causes aerobic glycolysis. So I will show you the techniques how to use a Bhastrika pranayama during your yoga asana practice combined. So all the people who comes to me now, he says, I had to sit down in a chair and do the practice. It's fine. Nothing wrong with it. But if you can keep on practicing, sitting down in the ground, that is a sign of health. We always tell you, simply able to get up just without a support. Put your both the hands, you're sitting in a chair. Always when you sit in a chair, keep your spine straight. I'm sitting in a kneeling stool, and get up without a support. Just sit down in a chair, get up without a support. And good enough. This is good enough for people of our age to do it. We will go all the way down. It is called your Molassan, squatting pose, and we'll get up without a support. Very good practice. I cannot go all the way down. You don't have to. Come down to a posture. Remember, in stages, impossible become possible. Come down to a posture, how far you can. Stay here. Hold on to it, stay here. Close your eyes. Breathe out longer than breathing in. In a short time, you'll see this thing will happen. Eventually, this thing will happen. It happened to all of us. So it will happen to you too. First component of pranayama practice. Able to sit down with your spine straight. Sit down in a chair, keep your spine straight. Here I am in a kneeling stool, and you have all seen my kneeling stool. When you sit down in a kneeling stool, your spine is always straight. It's very important concept, kneeling stool. Manasthik, quiet down your mind. So, how to quiet down your mind? First, let's start with a little relaxation. In your pranayama practice, it is your whole muscles of respiration. There's a muscle for inhalation, muscle for exhalation. And all the breathing is done through your nostril. We don't use mouth for any breathing. So when you do a relaxation of these muscles, you get a better pranayama practice. So start with your hands. If you look at a baby, baby is the most relaxed. Baby will close the hand like this, thumb inside and close. This is called a baby fist. Balo mushti mudra. Balo means baby, mushti means fist. Baby fist. This is also called your Adhi mudra. And then you look at a lung. Lung is like a balloon. It has a 6-liter capacity. It needs only 1.5 liter to keep it open. If a 4.5 liter, you can exchange, which is called a vital capacity. So you need to learn how to breathe out. If you breathe out first, then slowly take a deep breath in and breathe out longer than breathing in effortlessly. Exhalation is parasympathetic. Exhalation is relaxing. Exhalation is the treatment for your pain. Exhalation is like your aspirin, your Advil, you name it. That's your long exhalation. So, when you do that, just relax, sit down, put your hands in the front, close your eyes, breathe out first, take a deep breath in slowly, breathe out longer and do a yogic fist, baby fist. Breathe in, breathe out. Breathe in, breathe out. You continue doing it for a while, you will see even all the pain in your hands. You know, the pain comes from your tightness of the joints. All the thing we talk about, arthritis, you know, and when hand is relaxed, you will see your fingers will go all different way. You can turn your hands, you know, the most flexibility of your hands. But if you're not relaxed, you know, the finger doesn't go a little bit like tight like this. So you can test it yourself, how relaxed you are. The wrist gets relaxed in extension. Breathe in and breathe out. I always practice with my eyes closed because with my eyes closed, I access my subtle body. Very important. Relaxation of the hands and wrist. Wrist has almost 8 bones, you know. And relaxation is very important. Elbow tightens up in called external rotation. And if you can do an internal rotation, like turn inside, it is a relaxation. You know, like a tennis elbow. Tennis elbow is like this. So if you look at the internal rotation and you put your hand in the back like a prayer pose, or Paschim Namaskar, takes care of the elbows. Shoulder relaxation comes with the rotation of the shoulder. You can put your elbows together, eyes closed, breathe out first, slowly breathe in, breathe out, just rotate your shoulder very nicely. You know, we do it a little longer and I'm just showing it to you. So I'm showing it. Breathe in. And even if you cannot bring it together, wherever you can put is okay. But if you can put it together, it's great. Then also you can do it other way. It's a wonderful practice. Shoulder is a ball and socket joint. You can rotate your shoulder because it's a we generally do take a little bit of a weight in the hand, 10 pounds, 15 pounds, then you go forward and backward. Hold your hand in the top, breathe out first, take a deep breath in, pull your hand down behind your head down. And in the same breathing cycle, come back in the top. Like this. Breathe in, breathe out. The same breathing cycle I completed. Breathe in. You know, you feel the effect of relaxation. Pain is going to run away from you. Pain says, this is not the body I need to be in. It is to relax. Then you get into the whole upper body relaxation with your prayer pose to the back. So in a prayer pose to the back, you put your hands first. Wherever it comes, if it is coming, stay here. Close your eyes, breathing out longer than breathing in. Put your hands together and slowly a phase will come when you will be able to put a prayer pose to the back. And with your practice, this is going to be like your normal posture. I'm sitting down because my brain developed a neuroplasticity. That means my brain knows that's how I need to sit. Brain allows me to sit like this. Same way with the practice, brain knows I have to put my hand like this. Brain allows you, and I can go a little bit more higher up. And I can stay here as long as you want me to, because this is my normal posture. It's opening up my chest. It is relaxing all the muscles of respiration. I can feel, or I can show it to you. I have a lot of saliva in my mouth. My mouth is completely wet. I've been talking to you for some time, but the mouth is still wet. That means I have a lot of parasympathetic activation. In parasympathetic activation, you get a saliva coming out. When you get scared, when you get a sympathetic, what happens? The mouth gets dry. So, for the chronic neck pain or chronic pain, first what is approach is your quieting down your mind. Mind in yoga is a content of your five senses. I hear, I see, I smell, I taste, and I touch. Once I quiet down my five senses, the pain is generally gone. So let's start with the practice. Remember, you are sitting on a chair. Use your hand mudra. Touch your index finger and thumb. This is called your Dhyana mudra or Jnana mudra. This hand connects your body and mind. It quiets down your mind. Remember, pain is also central. It comes from your brain. So quieting down your mind basically is quieting down your limbic system, amygdala and hippocampus, and that is a powerful component of pain relaxing. Put it gently over your knees. Follow your breath. Visualize your breath. First, always breathe through your nostril. Do not breathe through your mouth. Mouth is for your eating and talking. Visualize your breath outside your nostril. Visualize your breath coming in through your nostril. Air is getting filtered inside the nostril. Our nostril is like a personal air conditioner. Outside air is warm, it will cool it down, and outside air is cool, it will warm it up. Air goes to the side of the nostril called a turbinate. It's like a groove by which air develops into like a vortex. The vortex goes over the mucous membrane of the sinuses, and the mucous membrane releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator, like it opens up the blood vessels, and it also is an activator of the parasympathetic tone, like your acetylcholine and cyclic GMP And nitric oxide also maintains your endothelial health. Once your endothelial health is good, the pain just goes away from your body. Air is going behind your throat, upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. The breath stops at the level of belly button, called cable kumbhak. Then the breath is coming out through your lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, through your nostril, breath is coming out. Once you visualize your breath, then you start practicing breathing out longer than breathing in and slowly increasing the timing without any effort. Whole pranayama practice for healing should be done as if it is your normal breath. And with the practice, you'll see the numbers will get longer and longer. There is nothing called a deep breathing. Deep breathing is going to come to you. So technique is breathe out first without any effort as long as you can. Breathe in again without any effort. Breathe out longer than breathing in. Within a short time, you will see that your breathing becomes completely effortless and the number of breathing cycle will come down. For example, it will be very easy for you to do count of 2 in and count of 4 out. 2 second in, 4 second out, 6 second cycle. Your breathing rate was normally 15 to 16 per minute. It will come down to 10 per minute. We have been doing it for so long, we can do very easily 6 second in, 12 second out, 8 second in, 16 second out, even 10 second in, 20 second out without any effort. Just to give you an example, let me show it to you. 8 second in, 16 second out. That means count of 8 in, count of 16 out. I will breathe out first, then I'll do it very silently with my eyes closed, and you will watch the timing. Breathe out first. And very simply count of 18 and count of 16 out. When you have a cough, that tells you that your pranayama practice is successful. That means all the air is going through your larynx, cervical cord. See, in your mouth, if you use your mouth, you have no idea where the air has gone. Either it's gone to the lung or it's gone to your stomach. But somebody says, if I have to use it, what you can do, you can breathe in through your nostril, breathe out through your mouth. But on the other hand, what happens when you breathe out through your mouth, then you lose the efficacy of the muscles of expiration. There's muscles of inspiration, muscles of expiration. Next, in the same position, next pranayama you do there either a chanting Om Pranayam, or the best one is called your Pranayama. Pranayama, Om has a three component. A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. And that also accompanies the mudras. And I can tell you one thing, I'm doing the practice now, I'm touching the tip of my index finger, this touch. My feeling, I don't have much feeling now between the tip of my fingers. I can feel even the capillary pulsation. So trying to tell you that the pain sensation, even the tip of my finger in normal, pain finger is gone. So if you do this, when the palm is up, it is called your Dhyana Mudra or Jnana Mudra. But if you put your hand down, it's called a Chin Mudra. When you fold your hands down, it's called a Chinmay Mudra. And when you put your thumb inside and close, it's called your Adhi Mudra. In a Pranabho Pranayama, you do A with your Chin Mudra, U with your Chinmay Mudra, and Ma with your Adhi Mudra. Very powerful tool, powerful pranayama for a pain relieving. Chin Mudra. Breathe out first. Chinmay Mudra. Adhi Mudra. You already started to look inside. Introspection. Mind is the content of your five senses. You shut down your five senses, then you create a vibration called a Brahma Bhramri Pranayama. In your Bhramri Pranayama, and you will see, we'll use the Bhramri Pranayama with the neck movement. So let's show you one Bhramri Pranayama. So you shut down all of your senses, put your index finger in the forehead, either use the Shanmukhi Mudra or use your 3 fingers to close your eyes, use your thumb to close your ear and close your mouth. We'll breathe out first, then you take a deep breath in and breathe out with the sound of a bumblebee. Bumblebee has the same frequency as the frequency of your brain and your whole body. So the 2 frequency cancels, it's called a harmonic resonance, and mind quiets down. Breathe out first. Then you're humming and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove the glasses. Take your hands like a cup. Put it over your eyes. Let the eyes take all the heat and the eyes gets relaxed. Eye is supplied by over 4 or 5 cranial nerves. Retina is supplied by the optic nerve, then called SO4-LR6. The muscle superior oblique is supplied by 4th cranial nerve. Lateral rectus by the 6th cranial nerve. Then we have the trigeminal nerve portion and also the facial nerve. These are all the cranial nerves. Also relaxes the ciliary muscles, which tightens up your lens, so your lens gets relaxed. Massage your forehead, massage your eyes, massage your face. All the muscles get relaxed. All the muscles are attached to your skin. So all the line, all the frowning, all the wrinkles generally slowly goes away. Put your hand, relax, massage behind the earlobe, in the ear, inside the external auditory canal. There's a nerve called auricular branch of the vagus nerve. Vagus activation is your parasympathetic activation. Massage your carotid sinuses. Carotid sinus is supplied by the glossopharyngeal nerve. It quiets down your cardiovascular system and nervous system. Take your hand, massage your occipital tubercle, the muscles, your sternomastoid and trapezius, which are also supplied by cranial nerve. Quiet down in your mind is the therapy for the treatment, both peripheral and the central. Now the neck pain is due to the tightness, and you will feel that one time that a movement will cause tightness. And the tightness, will get in the morning. It's called torticollis, And your grandma used to say, put your pillow outside in the sun, then sleep on the warm pillow. Basically, warmth, what it does, warmth causes vasodilatation, warmth causes relaxation. So regular Bhastrika Pranayama, as you know, is the active inhalation and active exhalation. So Bhastrika will be like this. So we do actually in the morning, we do I have a bellows here somewhere. we do the neti part. So we do get some drainage throughout the whole day, but it is normal. But also you can do the Bhastrika Pranayama. Just simply put your hand. Just to let you know how powerful this pranayama is that I had a little bit of a mucus plug, and the mucus plug came out with the Bhastrika Pranayama. The importance here is that these two channels, which is carrying the air inside your body, needs to be open. That's the reason we do the Jalneti every morning. There's a lot of other advantage. And here, this pranayama removed my little mucus plug. Both of my nostrils are absolutely wide open. Also, you can do it hands like we do one slow speed, medium speed, high speed. Let me show you in a slow speed of 10, medium speed of 10, and fast speed of 10. When you do it with your Adhimudra. Medium pace. Rapid pace. We generally do 20 of each cycle and generally repeat the cycle. So you can see we do a very, with our health tracker. So we do with a health tracker, so we know that all of our parameters are here. So for a pain, neck pain, first, so wake up in the morning, you have a pain turning your neck. So find a spot where it is just short of pain. So you put your hands in a Dhyana Mudra, put it over your knees, turn your neck slowly, just short where there is a pain. Now you do breathing out longer than breathing in. Within a 5 to 10 breaths, you'll feel the effect that, something is happening in your neck. Next, what we do in steps, same place, same phenomena. You can do also the Adhimudra. Adhimudra is very relaxing. Remember, is a baby mudra, baby fist. Here, you do a Bhastrika Pranayama, turn your neck where there is a pain, stay there and do. neck pain will have any chance to stay in this abode, in this body? Hopefully not. So go to the posture what is causing pain. Don't go up to the level of pain, short of pain, and in that posture do your Bhastrika Pranayama. As I said, Bhastrika Pranayama, like yours, is a pain medication. You can do the same thing also, raise your hand, like if you turn your head, or maybe turn your other side, just for the, to showing it to you. Suppose you're pain on the other side. From the other side also, close your eyes, turn your head and do. Keep doing it. Within a short time, this is also almost like a acute for pain medication. You can do it. It's going to go away. It's a so powerful tool we have. Another one you can do is called going against the resistance and do a long exhalation. Say, okay, let me show you how to do it. Okay, say now turning this is causing pain. So short of pain, I'll put my hand, I'm going to push it opposite way. So you turn your head towards the side of the pain, put your hand as a counter pressure, hand with the Adhi Mudra, and you do the breathing out longer than breathing in effortlessly. It's a wonderful practice. Also, if you look at my nostrils, like you test your own nostril, you'll see your one nostril is more open than the other. See, for me, I'm testing it. So my right nostril is closed. I'm going to breathe in and out from the left nostril. Left nostril is completely open. Try with the right nostril. Did you notice? Right nostril, even it is open, it is slightly less open. Alternate nostril breathing, Anulom Vilom Pranayama, opens up both the nostril because it activates both sides of the brain. Left nostril is controlled by the right brain, right nostril is controlled by the left brain. So, one of the therapy for your neck pain, chronic neck pain, is the movement of the neck, called your Brahma Mudra. Very important technique. And we'll see that we'll be doing the 4 postures of the neck with the Brahma Mudra, with first longer exhalation, then we'll incorporate your Brahma Mudra with your Bhramri Pranayama. People always ask me, how did you develop this thing? These are all came by our own personal practice and also group practice, because we have been doing and teaching for a long time and people getting better. In a traditional yoga practice, it's 8 limbs yoga. Yam, Niyam, Asan, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. In your yoga therapy practice, we combine asana with pranayama, asana with meditation, asana, pranayama, meditation together. And we check with our health tracker. Very, very important. Very, very important. So, in a Brahma Mudra, we generally practice everything with our Adhi Mudra. When you get Adhi Mudra, in fact, we're practicing it for so long, our hand goes to like this without even making any asana practice. In the front and back, you breathe out first. Take a deep breath in and slowly drop your head to the back. And breathe out, drop your head in the front. I'm looking for two signs, pain and effortless breathing. If I get a pain, I back off. I don't go up to the level of pain. And I look at your breathing. Effortless breathing means I can talk, I can sing, I have absolutely no issue. Same way, breathe out first. In our practice, generally we do about 5 times. Second, side to side. Breathe out first. Deep breath in. Breathe out and drop your head on one side. Same way on the other side. All the way back without turning your neck. Other side. Finally, the neck rotation from the front to the right, to the back, to the left, to the front. Remember, never practice this by taking a pain medication, because you want your pain, remember, pain means pay attention. Body is telling you something is going on because you have a pain. So, put your head down, breathe out first, take a deep breath in. Do the other side also. Breathe out first. These four movements are called Brahma Mudra with a longer exhalation. You can do all these four postures for chronic neck pain with your prayer pose to the back, called Paschim Namaskar. Put your hands to the back, prayer pose to the back. And then instead of a long exhalation, you incorporate your bumblebee, Brahmi Pranayama. Let me show only one posture just for the show it to you, then you will practice in other four postures. Let's do the front and back. So breathe out first. Slow, long breathe in and put your head to the back. Now breathe out with the sound of a bumblebee. Look at the physiological component. You are relaxing your whole chest and all the muscles with a prayer pose to the back, Paschim Namaskar. Quieting down your mind with the sound of a bumblebee, because two frequency cancels, called harmonic resonance. Then movement of your neck. Remember, people ask me, oh, I have a surgery in my neck, I have some screws, plates. It really doesn't matter if you are not taking any pain medication, and if you don't cross the line of your pain and you stay within your effortless breathing practice. Next one is a very important. This is called your chin lock, Jalandhar Bandha, and the chin lock is associated with your breath holding and inhalation, called Abbhantarin Kubbhak. You breathe out first, take a deep breath in and hold, and then incorporate your chin lock. Chin lock stimulates the carotid sinuses both sides, It's a profound relaxation response, and breath holding in inhalation. See, lung starts to expand, but it cannot expand anymore because of the rib cage. Then at the level of pleura, you have the vagal activation. Vagal nerves get active. It's called a Herring-Brewer reflex, and starts to reduce the size of the lung, and it's called a vagal activation. Puts you in a profound level of relaxation to the point, this is even called a murcha pranayama. Murcha is almost called unconscious. I'll show you about 2 or 3 more very deep, relaxing pranayama practice, which will lead you for a daily, complete cure for your pain in the neck. Remember, pain in the neck is the term we use all the time, how painful it is. Chin lock is you keep your spine straight, keep your shoulder, and slowly put your chin down close to your chest, and you stay here. Chin lock is also, you can do associated with your abdominal lock and a root lock, which is called a great lock. These are all very powerful, relaxing practice. So the Murcha Pranayama. Murcha Pranayama is your breath holding in inhalation with a chin lock. So breathe out first. Long breath in. Hold your breath and do a chin lock. Keep counting how long you can hold your breath without any effort. Generally, in a good breath holding and inhalation, 40 to 45 seconds is pretty good. And breath holding in exhalation, which is also very relaxing, is about 20 to 22 seconds. It's very good. So wonderful practice called Murcha Pranayama. Then you can do Ujjayi Pranayama with your chin lock, and then with the left nostril breathing. Ujjayi Pranayama, Jalandhar Bandha, Chandravedi Pranayama. All together, this pranayama will create a profound relaxation, and it's like a profound pain relieving practice. Okay, in my hands is Nadhi Mudra. In a normal Ujjayi Pranayama, you just close your larynx and breathe in and out like this. We call it a dark feather breathing. Then you go a little deeper. Then you start doing like a deep your Ujjayi Pranayama like this. When you get a cough, that is perfect. That means you're really affecting your vocal cord. That means your pranayama practice is exactly where it needs to come from. So let me do a long Ujjayi pranayam with a chin lock and left nostril breathing. Wonderful practice. Ujjayi pranayam, Jalandhar bandha, and Chandravedi pranayam. Last word in yoga therapy. Pain will say, that's it. This is not the body I need to be there. One very important source of pain is your imbalance in both sides of the brain. We are lateralized. I'm right-handed, right-footed. I'm using it again. My other side, my left brain is not being used. Sorry, my right brain is not being used. So alternate nostril breathing. And then you can do a meditative alternate nostril breathing. Let's finish the practice. It's a wonderful practice. And when you do it, you will see the effect of pranayama for chronic pain, especially the neck pain. And when you can use, even you can do all the pranayama practice with the movement of your neck. Left hand, use a dhana mudra or a jnana mudra. Close your right nostril. You don't have to press all the way down, just below. Breathe out through your left nostril. Slowly breathe in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through the right nostril. Breathe out through your left nostril. Continue the alternate nostril breathing. Left nostril is controlled by the right brain. Right brain is intuitive, cooling, female, parasympathetic. Right nostril is controlled by the left brain, which is analytical, male, heating, sympathetic. Balance between both analytical, intuitive, between sympathetic and parasympathetic. Slowly you put your ring finger and middle finger in the third eye. Bring your concentration in the third eye. Use your left hand. Hold your right ear lobe. That is your super brain yoga, and continue alternate nostril breathing. In a short time, you have no idea even where you are, what is happening, and pain sensation literally goes away. Continue as long as you can do it without any effort. That means you can talk, you can sing. And if you can continue, like for us, we can do about 5 to 10 minutes. end of a practice called meditative alternate nostril breathing or meditative Anulom Vilom Pranayama. As you know, we discussed about many times, the meditation is the medication. Initially, it looks like it's almost impossible, but it is so possible. Close your eyes and you will see, you'll be able to do alternate nostril breathing without closing your nostril. It is same phenomena is called your gross body and a subtle body. Gross body is called Sthula Sharir, subtle body is called Sukha Sharir. Like when I close my eyes, I can access my subtle body. My subtle body is body of my mind. I can visualize my subtle body. I was in Norfolk, Virginia Beach last weekend. I was in a program, and also at the beginning I did a program in a city called Portsmouth, Virginia. I can see I'm in the yoga studio. I'm entering through the door. I'm sitting down where I'm supposed to teach. Totally can visualize your subtle body in some other place. Same way, quiet down your mind with your Adhimudra. Bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Close your eyes, stay in silence, keep your spine straight, and continue this alternate nostril breathing without closing your nostril, and you slowly will enter into a state of meditation. You can continue for some time. It's a wonderful meditative practice. Slowly bring your hand in front of your heart chakra, Anahata chakra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Padma Mudra. This connects your body, mind and spirit. Bring it close to your heart. Heart is the site of your soul. We always say, memorize by heart. Heart and mind and brain are all connected. This practice, even if you do 50% of this practice daily, or maybe even 25% of this practice daily, you will see a tremendous benefit from this practice, getting rid of your chronic pain and especially chronic neck pain. Yoga therapy definitely treats a disease called your Roget Chikitsa, and it maintains your health called Shastra. It is the activation of your parasympathetic tone. So I've been talking to you for last, almost hour and a half. I still have a lot of saliva in my mouth. I'm still secreting saliva because I'm in a parasympathetic state. Bring your hands together in front of your heart chakra. Put your head down. In yogic version, you say Namaste. I honor the divinity within you. You are divine, and I honor the divinity within you. Maintain a wonderful, peaceful life. Stay in a relaxation response and parasympathetic activation. The pain is going to run away from you. So wonderful practice. Keep doing it. And then if you have any question about how to get a relief from your chronic neck pain through pranayama practice, please send me a comment or a question. I'll be glad to answer for you. Again, we're doing all the requests, and as I'm saying, the request I'm getting these days are all from this our senior citizen, because they're having a pharmaceutical failure of their chronic lifestyle related diseases, for which yoga therapy is a wonderful practice. Next weekend, I'm going to be in Dallas, Texas. I'm going to be presenting in a physicians group, yoga therapy for metabolic syndrome. And as you know, metabolic syndrome is the outcome of our stressful good living with we call it a sympathetic overdrive. So yoga therapy for metabolic syndrome, and we'll have a little practice demonstration of yoga for health and healing. So I won't be here next Saturday, but probably if I'm here in the Saturday after, we'll start another session, which probably going to be another request session. Okay, thank you for joining. Hope to see you again in 2 weeks. Okay, bye-bye.